Perfect. Thank you very much for inviting us to speak today about quality in early learning and childcare. And maybe while the PowerPoint is getting set up, I'll just say my name is Lauren. I'm a research assistant at the Community University Partnership for the Study of Children, Youth, and Families, also known as CUP. Mackenzie Martin is a research associate, also at CUP. Ping Lam Ip is a PhD candidate with the University of Alberta. Jeff is a professor emeritus at the University of Alberta and also a member of the Edmonton Council for Early Learning and Care, also known as the ECELC. And Manal is the director of Early Learning and Care at the ECLC. So we can move to the next slide. So today we're going to walk through some background information about early learning and childcare in Alberta and about our survey. So Mackenzie and Ping Lam will provide an introduction to what we've learned about quality so far from parents, followed by Manal and Jeff discussing ECLC's position paper on quality. And then at the end, we will gladly welcome any questions. Next slide. So to start, for those who don't know, the Edmonton Council for Early Learning and Care is a council of over 20 members from across Alberta and across the sector. So that includes people from the front line, academics, government, and community representatives. And the vision of the council is that early learning and childcare is available for all children. It's high in quality, accessible, affordable, inclusive, and responsive to all children and families. And within that, it connects unique research in the province of Alberta, some of which we will talk about today. So as most of you likely know, in 2017, the ministers agreed on a framework for building systems of early learning and childcare that are based on 5 principles: quality, affordability, accessibility, inclusion, and flexibility. The framework was followed by a 5-year financial commitment by the federal government to a Canada-wide early learning and childcare initiative. And this initiative is being implemented in Alberta through the Canada-Alberta Agreement. And then the cost control framework then guides the sound and reasonable use of public funds within the agreement. So today we will be talking specifically about quality in early learning and childcare. There's been a lack of clarity as to what quality actually means. And so the ECLC has been working on research related to quality over the past year, and we're excited to share it with you today. So the availability of high quality, affordable early learning and childcare is widely recognized as a key component in reducing poverty, in enabling parents, especially women, to advance their education and seek employment outside the home, and in promoting well-being and positive developmental outcomes in children. So high quality is critical if early learning and childcare is to yield important benefits for children, families, and communities. So before we dive into the survey, it's also important to highlight why parents' voices matter. Parents are important stakeholders in the early learning and childcare system. They offer unique insights into their child's needs and can help us ensure that early learning environments reflect children of all backgrounds and needs. In addition, when parents are asked to participate in decision-making or provide feedback, it may strengthen the relationship between parents and educators. And so the success of the CWELC initiative will depend in part on if it meets the needs and expectations of parents. So the first 2 papers that we will discuss are based on the Alberta Parent Survey on early learning and childcare. The survey was funded by the ECLC and the Mootart Foundation and was designed by researchers at CUP. Participants included over 1,400 parents with children between 0 to 5 years of age, and data were collected from Advantage's large randomly recruited panel of Albertans in the spring of 2022. It's important to note that this was about 5 months after a new program for subsidies and affordability grants was implemented in January of 2022. The goal at the time was to reduce average parent fees by 50%. Data were weighted using the 2021 Canadian Census. And for data collection, we looked to see if the results varied by location, annual household income, number of parents in the family, and their subsidy status. And it's also important to note that throughout this presentation, when we refer to childcare arrangement, we mean any type of regular care provided to someone other than the child's parent or guardian, not including occasional babysitting or time spent in school. And so based on this survey, we've generated 5 reports, including one on quality, which Mackenzie is going to talk about next, And we're also currently working on an academic publication focused on the one qualitative question in this survey, which Ping Lam will introduce later. So with that, I'll pass it over to Mackenzie.
Get back going here. So hello, everyone. Thank you so much for being here. I've been tasked with going over what parents said about quality in response to our survey questions. And as Lauren mentioned, these findings are summarized in much more depth in a report on the ECELC website. And if you're interested in seeing a summary of this report, we also have a 2-page document summarizing what we found, and there's also an infographic on the website as well. So now on to the results. So our survey asked parents about their views on quality in several ways, and I'm just going to give a very high-level overview here today. So first question is the quality of early learning and childcare important to parents? Most parents in the survey identified quality as a key factor in selecting a childcare arrangement. In particular, 58% of parents ranked quality as one of the 3 most important factors they would consider in choosing a childcare arrangement. Quality was cited more often by parents from families with higher incomes than families with lower incomes, and quality was cited more frequently in more densely populated areas than in less populated areas. Regardless of income or location, however, a good number of parents thought quality was important in their decision-making. Second, when parents have difficulty finding childcare, is quality a problem? About a quarter of parents in our sample indicated they had difficulty finding childcare in the past 3 months. 53% of these parents reported at least one quality-related problem. 41% said they had trouble finding the quality of childcare they wanted. 20% said they had trouble finding a qualified childcare provider, and 17% said they had trouble finding licensed childcare. Next slide, please. So third, what was the impact of these quality-related difficulties? Of the parents who reported quality-related difficulties, many reported significant disruptions to their work as a result. 52% changed their work schedules, 47% worked fewer hours, and 31% postponed or discontinued work altogether. Fourth, are parents concerned with the quality of childcare in their communities? About 1/3 of parents expressed concerns about the state of local childcare. 40% of parents who reported concerns cited poor quality as a problem. However, poor quality was cited as a concern somewhat less often than the cost of childcare or the availability of spaces in childcare. Next slide, please. So this was just a very quick, short overview of what we found. There's more depth in terms of our findings in the report. But these findings suggest that high quality early learning and childcare matters to Alberta parents, and that quality-related difficulties pose a variety of challenges for Alberta families. The importance of high-quality early learning and childcare is emphasized heavily in all the foundational documents of the Canada-wide Early Learning and Childcare Initiative and in the bilateral agreements between the federal government and provincial and territorial governments. Little has been done, however, to implement or improve standards for quality in Alberta. So if Alberta's version of the CWELC initiative is to match parents' desire for high quality, the following recommendations that we've put together might merit some consideration. So our first recommendation is that a commitment to high quality early learning and childcare must begin with a clearly articulated vision for what high quality should and will look like. Alberta's provincial government must articulate a vision of high quality early learning and childcare. Principles and regulations must be defined that provide shared expectations for parents, early childhood educators, policymakers, and legislators. These principles and regulations must be justified in terms of the existing evidence, best practices, and community needs, and they must be designed primarily for the benefit of children and families. Our second recommendation is that a plan is needed to implement the changes required to realize the new vision for high quality early learning and childcare. This plan must identify what is necessary for achieving the vision, including policies for service delivery, funding, regulation, planning, public accountability, and more. As has been demonstrated in other jurisdictions, Progress toward building a high-quality system can be derailed or delayed when the vision for early learning and childcare and the policies to implement that vision are inconsistent with each other. Our third recommendation is that quality must not be sacrificed in the service of improving affordability and accessibility. There is overwhelming evidence showing beneficial outcomes of high-quality early learning and childcare for children, families, communities, and our economy. Policies that attend entirely to affordability and accessibility, while ignoring quality, may appear to be satisfactory in the short term. In the long term, however, this is likely to have unintended and potentially negative consequences. So a comprehensive approach to improving early learning and child care is needed. So I've just summarized the results of the quantitative survey questions that we have in our report, which you can find online. And now that you've heard about how parents responded to our survey questions, I'm now going to pass it over to Ping Lam to discuss what parents said about quality in an open-ended question about what high-quality childcare means to them. Next slide, please.
Thank you. So in our survey, there's an open-ended question asking parents what high-quality childcare looks like to them. And in order to understand parents' definition of quality, we did a thematic analysis on more than 1,000 responses to this question. And these responses range from just one word like safe to a paragraph of about 170 words. But most of the written responses were just a list of keywords or short phrases. Next one, please. Thank you. Now, before I go into details of how parents define childcare, quality childcare, there's a need to talk about why it is important to understand parents' perspective. In the literature that we saw, most studies defining childcare quality came from a professional and academic perspective, especially in the field of developmental psychology and the field of early childhood education. They specifically focus on how to promote children's developmental outcome by improving the classroom environment as well as the curriculum, which means studies focusing on parents' perspective are relatively rare. And some scholars have already argued that the academic and professional view on quality don't always align with the everyday needs and preferences of parents. So if the implementation of quality fails to address parents' needs and their preferences, and families may not be able to harness the full benefits of childcare, which is why it is important to study parents' definition of quality and compare the definition with those of academics and professionals. The next one, please. Thank you. So from our study, we found 10 themes of quality in parents' responses. Now, given the time limit here, I won't be able to go over everything. So I will just focus on 3 of them. What is important from this slide is that in general, you can see that parents' definition of quality cover a whole lot of things, going beyond just the classroom environment and the curriculum. So we have themes about development, of course, but we also have themes about safety, professional caregivers, meeting children's needs, paying attention to children, and also issues about affordability, accessibility, and so on. The next one, please. The first theme I want to focus on is about promoting children's development, growth, and education. And the only reason why I want to talk about this is because this theme has the largest frequency. Almost 60% of parents in our sample said something about children's development and education when they were defining quality. So from these responses, we could identify 8 areas of development that parents want their children to undertake. These areas include physical environment and the development of some kind of relationship with nature, the learning of social and communication skills, academic development, of course, and the nurturing of creativity and talents, the education of moral values and appropriate behaviors, learning some kind of basic and practical life skills like hygiene and stuff like that, and emotional and mental development, And there were some comments just talking about letting children experience new things in general. But other than the areas of development, some parents also talked about different ways through which the development and education of children should be carried out. And we could identify 5 ways that parents' response talking about. So, for example, some parents think that a curriculum should be challenging and stimulating, which means there should be a certain level of difficulties so that children can learn through, for example, making mistakes. Some also think that the programming in the curriculum should be play-based, should be fun, should be interesting, and should also be tailored to children's age, abilities, needs, and interests. Some parents also gave some general comments about childcare being able to respect individual ways of learning of each children. And there are also some parents who name a very specific curriculum, like the Fright curriculum in Alberta. The next one, please. So the second theme I want to elaborate on is having professional caregivers. Now, I guess many of you here would like to know what parents said about caregivers and educators. That's why I will talk a little bit about that. Actually, quite a number of parents, almost 40% of them, want their caregivers to be professional. And they prefer caregivers to have a certain set of qualifications, skills, and experience, like having a post-secondary degree, especially in the field of early childhood education, having some sort of skills in managing children behaviors, and also having the skills to communicate with children. And some parents also want caregivers to have some positive attitudes and personality traits, which can show that they are really committed to childcare and the education of children. For example, they want caregivers to be passionate, to be caring, and to be attentive. But not just that. And I guess this is a very important point. Many parents actually care about the well-being of caregivers as well. So, for example, there are parents who want caregivers to be well-paid or professionally compensated. There are also parents who want caregivers to have a lot of resources for professional development. And some think that caregivers should not feel overworked or burned out. And you can see that these comments actually really tie to the earlier view that parents want their caregivers to be genuinely committed to their job. The next one, please. Now, the final theme I want to touch on is about affordability, accessibility, inclusivity, and flexibility. And I think this is particularly important because now the Canada-wide early learning and childcare frameworks specifically mentions a vision of promoting all these principles. But the interesting thing here is that in the CWELCC framework, all these principles are seen as standalone concepts, external and alongside quality, external to and alongside quality. But what we can see here is that more than 30% of parents think that things like affordability and accessibility, they are actually defining characteristics of quality. Now, what does that mean? That means, for example, parents think that high quality childcare should have a low cost, not canceling out their income. Some think that childcare should be located close to their home or workplace. And some also want a flexible schedule of operation of hours for the childcare. And of course, there are some parents who think, childcare should be able to accommodate the special needs of children, for example, having chronic illness, disability, and also the cultural needs of children with a minority background. Now, the interesting and the important thing here is that if parents are not able to access a childcare arrangement because of, for example, a very high cost or an inconvenient location, even if that childcare has a very good curriculum, some parents would not even consider this type of childcare as high quality. Next one, please. So from the above findings, we can have a few key takeaways. The first one, as can be seen by the slide about the 10 themes, is that Parents' definition of quality is multidimensional. It covers a lot of elements going beyond the classroom environment and also the curriculum. The second point is that parents have a very comprehensive and even sophisticated understanding of children's development and education. And their responses cover areas ranging from academics to physical growth to creativity and more. The third thing is that parents not only want professional caregivers, they also care about the well-being and the support of these caregivers. And last but not least, I think, and the most important point I want to make here is that many parents think that issues like affordability, accessibility, flexibility, and inclusion, they are not standalone principles external to quality, but defining features of quality. Now, I will pass on to Jeff and Manal to talk about recommendations and sum up today's presentation.
Okay, thank you, Joe. In our work, which has been reviewed by Lauren Mackenzie and Ping Lam, we found that the term quality was often used but rarely well defined. Some people talked about quality as whatever is specified in legislation or regulation, which, as you know, is minimal. And it just doesn't convey much about what quality could and should mean. And as you've seen, parents talk about what quality looks like in many different ways. Everyone says that they care about quality, but all this caring is unfocused if we all can use the word to mean very different things. So the Edmonton Council for Early Learning and Care decided that a common definition and framework is needed. Next slide, please. So the council reviewed a wide range of sources. Oops, one back, please. Reviewed a wide range of sources, and we developed a position paper, which you can see on the screen here. Manal and I will summarize this paper, but I encourage you to go online at ecelc.ca and take a look at the full paper, or at the 2-page summary, or at the 1-page very brief description. So you have options. Next slide, please. So what do we mean by quality? When we talk about high quality early learning and care, we're not talking about occasional babysitting, and we're certainly not talking about warehousing young children. High quality early learning and care is intentionally designed to nurture the social, emotional, cognitive, and physical development of children. It's evidence-informed, inclusive, and based on the rights of children. And it requires ongoing contributions from educators, parents, and communities. This last point is important because the concept of quality is constantly evolving. We get new evidence from research, practices improve, and the need and aspirations of Alberta's families change over time. And so how we think about quality should change over time. Ongoing discussions about what quality should be also involves the views of early childhood educators, researchers, policymakers, and, as you've heard, parents. Next slide, please. When we think about building a system of high quality early learning and care, it's useful to think about 4 different kinds of quality. At the right, we can think about outcomes we want to see. Obviously, we want our children to benefit, but we might also want early learning and childcare to help families thrive and to build communities. Economists talk about benefits for the economy. There is evidence that early learning and childcare done well with high quality can contribute in all these different ways. Next, moving from right to left, is process quality. This can refer to the kinds of interactions that take place between early childhood educators and children, but it also refers to the interactions between children, between educators and parents, and even between educators themselves as they support each other's learning. As you all know, these process interactions contribute strongly to the outcomes we want to see. But for these process interactions to be high in quality, they must be supported by rules and regulations that provide some structure. Structural quality, moving to the left, can consist of child-to-educator ratios, requirements for space, standards for safety and health, qualifications for early childhood educators, accommodations for children with disabilities, the use of evidence-informed curriculum framework, and much more. The point is, all these structural rules and regulations are things that typically can be regulated. It's much harder to regulate process quality. The rules that provide structural quality come from somewhere. Sometimes they're created by the early learning and childcare providers themselves. They also come from legislation, regulations, and policies created by governments. Governments determine systemic quality, what we can call systemic quality, in many ways, such as planning and funding, setting standards for professional support and compensation, and monitoring and evaluating how well the system is functioning and for whom. Now I'd like to show you the rest of the diagram. Next slide, please. This diagram looks complicated, and we won't go through it in detail. The point is to emphasize that a lot of different things must be in place to get high quality early learning and childcare. But just follow the red arrows from left to right, starting with systemic quality. Notice on the left, under operations, a lot has to be going on within government to generate good quality legislation, regulations, and policies. Following the red arrow upward from that box at the lower left, we see that legislation, regulations, and policies generated at the system level certainly influence the structural quality in the learning environment. And learning environments can include centers, family day homes, and preschools. And structural quality in those learning environments influence process quality, those important interactions that contribute to the outcomes we all want to see. But also notice, back to the left and the bottom, that there is a professional environment for early childhood educators, which is also influenced by legislation, regulations, and policies, and which also is important for generating the outcomes we want to see. The main point is this: when we talk about building a system of high quality early learning and childcare, we need to be thinking about this whole picture, about how the system influences what goes on in the learning environments and professional environments, and how these in turn affect outcomes. What is needed is a high quality system that includes everything on this diagram. Now I'd like to turn it over to Manal.
Thank you, Jeff. So the next slide, please. Yeah, so to achieve truly what we defined as high quality early learning and childcare, we must act across these 6 areas. We need a fair, sustained public funding focus on staffing, infrastructure, and access, especially for the underserved communities. We need a program this program must be safe, welcoming, and responsive to all the children's identities and needs, considering children's rights as well. Governance should involve both local and provincial voices to ensure consistent quality, clear responsibilities, and strong regulation like staff qualification ratios, which are essential for setting and maintaining standards. Educators need continuous supported learning and real career pathways to grow and lead. We need systematic monitoring, evaluation, and research to assess equality across children, families, and educators, as was in the diagram. This evidence guide policy, highlights gaps, and helps the program to stay responsive and effective. Families and communities must be active partners in shaping responsive, inclusive programs. So together, these 6 areas create a strong, interconnected foundation for high-quality early learning and childcare system. Next slide, please. So here are the main 3 recommendation areas from our paper. So first, funding is not about covering cost, it's about ensuring equity. That means funding must support universal access and target underserved population. Inclusion must be built in, not added later. This includes support for staff, material, adapted resources, and inclusive programming. We recommend also linking funding to clear indicators for high quality. This will introduce accountability and intensive for improvement. The next one is support and the workforce. Early childhood educators are the backbone of the system, yet many still face low wages, limited benefits, and poor working conditions. So we propose wage grades tied to qualification and roles, improved working conditions, and funded pathways for career development. This means supporting educators to move from basic certification into leadership, advanced credentials, and mentorship roles. The last one is to build strong monitoring and evaluation system. Quality can't be improved if it's not measured. We need systems that track both the structural and the process quality, as was discussed in the diagram, such as educator qualification and classroom interaction. So in the full report, you can expand more on these 3 points. You will find more examples and you will find indicators. So I hope by our explaining to our presentation today, just this message to be clear that we can't achieve high quality childcare through fragmented or unconnected efforts. It takes systematic investment, policy alignment, and workforce that respected and supported. So next slide. Yeah, so before we go to the questions, I just want to bring the 3 threads together. We began with Alberta Parent Survey, where parents made it clear that quality early learning and care matters, not just access and safety, but also their children development and enabling family well-being and economic participation. Next, in the qualitative data, it revealed to us that parents link equality to professional support for educators, culturally responsive practices, and system enablers to stable funding and family-centered policies. Finally, with the quality position paper, this ties all this together and offering holistic, equity-driven definition of equality along with systematic recommendations. So together, these 3 pieces shows how much parents really deeply care about equality and define it in multidimensional way, and that now we have the tool to move toward the shared vision of equitable early learning and care in Alberta. Thank you for listening, and I will turn it to Susan for the question and answers. Sorry.